today. Hi, I'm Najman. I'm your physio today.
Hi, I'm Van der Geest.
Yeah, Vanderkist. How are you doing today?
Well, everything is going well except my elbow problem, as I told you last time.
Yeah, we did the screening process. Now we are gonna do the some diagnosis thing.
Yep.
It's called diagnosis process. So by this process, we're gonna check your elbow perfectly. We're gonna talk a little bit. We'll have a conversation, and both of we try to figure it out what is the problem, and how can we cope up with these things. So at first we need to know what is the problem going on,
Yep.
what is the reason behind this, then maybe we can figure out what could be the solution for the
Clear.
next session. Okay,
Yep.
so we're gonna do the diagnosis process today. So in the process, if you have any question in the meantime, you can ask me anytime. Okay,
Okay.
it's not a thing that you need to keep on your mind, maybe ask you later. No, you can ask me on time. Okay,
Okay.
everything is clear for you?
Yes, it is.
Okay, so yes, your name is Van der Geest,
Yeah.
and maybe you are 48 years old.
Yep.
Yes. So yeah, so what brings you here today actually?
Well, as I told you before, I have a pain on my elbow.
Your
It's
elbow.
almost 6 months. I have this problem on the right side, exactly here, this part. I have pain.
Yeah.
And most of the time the pain is coming during household or while I do gardening. For example, after I wash my clothes, I wanna squeezing the water goes away. I feel a lot of pain on that. Yeah.
So okay, you are telling me like some things like squeezing problem,
And also packing.
packing problem,
Yeah.
and also household something.
Household
Yeah,
and
okay.
gardening, they are my habits.
Gardening,
when
okay,
I'm
okay,
at
okay.
home.
So yeah, there is some scales or something. We call it patient specific complaint.
Yep.
So if I gonna tell you 10 is more severe and 0 is nothing.
Yeah.
So where are you gonna put the rating, like A for squeezing? How much it is?
Well, for excusing, I can say 8.
8.
Yeah.
Okay, that's much. What about packing?
For packing, 6.
6. Okay. What about gardening thing?
It's also 6.
6. Okay. That's a lot of pain, huh? That's
Yes,
why,
it
yeah.
is.
So, so overall, if I'm gonna ask you, overall in your elbow, how much is the pain? Overall, not about the squeezing, not packing.
Well, orally is 4.
Yeah, overall
Yes.
is 4. Oh, okay. Then it's okay. That means sometimes you have some less pain, huh?
Yeah, the more activities provoke my pain.
Ah, okay, okay. So would you mind me asking, what do you do for a living?
Well, I'm an accountant,
Ah, okay, nice job.
but I don't like.
You don't like it? Okay, okay, okay. No problem. So, do you have any plan to skip the job and find another things to do or something?
Yeah, these days finding another job is hard.
Yeah.
And yeah, if I choose the job that I don't like, it means I don't have any choice right now. But if in the future I find a good opportunity for a skilled job that I like, I found myself, maybe I change it.
So this job make you some worried things or stress?
Yes, I'm an accountant of a big company and I have a lot of stress.
Ah, okay.
because, yeah.
Okay, I got you. So yeah, you told me like some thing when you're gonna do, you feel pain. Is there any specific movement that you feel pain?
Feeling pain more.
Yeah, feeling pain more is specific movements.
For example, I can doing this or I wanna rotate it.
Ah, okay.
hand.
Yeah.
It's painful.
It's
As you
understandable.
see right now, I'm afraid to do that completely, or doing like this.
Okay, understandable. Yeah. So what makes you better? Do you find any solution for this, like any movement, anything that can make you better? Really?
Maybe only remaining passive.
Remaining passive. That means taking rest or something.
Yeah, exactly.
Okay, okay, that's nice.
And again, it's painful but less painful.
Less painful.
Because the pain is also bothers me during sleep. That's I cannot sleep very well because of the pain,
Okay.
and that's making me more anxious. Because I'm really worried about that the pain is getting every day worse and worse and worse.
Understand, understand. Okay, so you also telling me that you are not sleeping perfectly. That means poorly sleep pattern.
Yeah.
Okay. Do you have any past medical history?
Well, in the past I had a neck problem
Yeah.
when I rotated to the right.
Okay.
Significantly during driving, I
Okay.
want to look to the right
Yeah.
before. But right now it's fixed. By my another problem in the past, I had a wrist fracture. It's fixed, but again, it's hard for me to move my hand to the
This
outer side of the body.
Okay.
It's painful, and another problem that doesn't belong to my bones, it belongs to my inside is a bowel disease.
Okay.
Yeah, I have a problem with that one.
Yeah, so a lot of things happened with you, huh?
Yeah.
That's why you were stressed a bit.
Yeah.
Yeah,
I think I'm too young for that much of problem.
Yeah, maybe. But what did your GP say about the bowel condition? Is it okay?
Irritable.
Irritable, but it's okay.
Yeah.
They find any problem on there? No.
Not yet.
Not yet.
Fortunately.
Yeah. Okay. And your wrist fracture is completely healed. You told me, yeah.
Completely healed.
But
only
sometimes
the
you
problem,
feel the pain
yeah,
on
it's
this
very
movement.
hard in that movement.
Okay, it may happen, yeah. So you also tell me that you have a sleeping problem. Or what about your morning thing?
Well, in the morning when I wake up, I have stiffness and pain for 10 to 15 minutes, and after that, the pain slowly reduces.
Okay. So what about night? Do you feel any pain?
Yeah, I told you I have a sleeping problem.
For the pain. Okay, okay. Recently, do you have any like fever,
No.
weight loss?
No.
No. Okay. Got you. Overall, like, who you're living with?
With my wife.
You have a wife. She's supportive?
Yes, she is.
Yeah. Do you have any kid?
No, not yet.
What about your colleagues? What they think about your problem?
Well, they care about me. They are sympathizers about
Yeah.
me.
Okay. And you are getting help from your wife also.
Yes. That's right. She's very supportive, fortunately.
What do you do for your spare time?
Most of the time gardening right now.
Okay. So you are doing gardening as well as before, or you increase the amount of time?
Now, I work less because of my pain, so at home, if I say I do not do anything, it's gonna be very, very overwhelming for me. That's why I prefer to do gardening.
Okay. That makes you any problem more, or what
Yes,
do you
the
feel?
pain getting a bit more.
So that means you want to do gardening more, but the pain is.
Yeah, I really like gardening.
Yeah. Okay. Okay. Got you.
When I do gardening, I get rid of the stress.
Okay. So, what do you feel about this pain? Like, the pain is hampering your life, daily life activities?
Exactly.
Yeah.
I
Well-
cannot ignore to it because it comes to me. Sometimes the pain is calling me with loud voice.
Okay.
I don't know
got
if
you.
I understand before you.
No, I understand. Yeah. So, what about your? Would you mind me asking about general health condition? Do you smoke or
Well, I smoke
you smoke
every
Okay.
day.
Every day. Okay.
Yeah, but not one pack. Yes,
Mhm.
and I also used to drink 3 glasses of wine every day.
Every day. Okay. And your GP told you something about these things? Is it good or bad? Or
About the smoking,
Or
he
what
warned
can
me, but I do not smoke that much. That may be a problem. But anyway, smoking is not healthy. But
Okay.
smoking is another reason for my stress.
Okay, okay.
I can say excuse, but I got used to that.
Okay, got you. Okay, no problem. So yeah, I have everything what I need to ask. So if I'm gonna give you some little bit of summary, that you are 8 years old, you have elbow pain for last 6 months,
Yeah.
and it's getting worse day by day, and you have pain. in general 4 out of 10, and you are accountant, and you do your gardening, squeezing, like your hobby is to gardening, and you feel pain on the gardening also.
Yep.
And you had a wrist fracture, you have a bowel condition problem like irritating bowel disease,
Yes.
and you have morning stiffness on your elbow, but it gets reduced by 10 or 15 minutes.
Yes.
Yeah, okay. And other conditions, yeah, I feel everything is okay, and your partner is helpful.
Yep.
Your colleague is also supportive. That you are getting stressed about your work because you don't like that work. So
Exactly.
yeah, that's the problem. By this stress, you cannot sleep properly.
Definitely.
Yeah, that's the problem. Okay, so further process, we gonna do some anamnesis.
Yep.
It's called anamnesis to, like, I'm gonna check your some thing like physical examination.
Yep.
I'm gonna check your elbow, and I have a hypothesis, like I'm thinking something happened to your elbow, but I'm gonna check by physically, and after that maybe I can find some conclusion, and then we can go further process for like treatment or something else. Yeah,
Okay.
is that okay for you?
Yes, it is.
Do you have any question for me?
No?
No, not yet. Okay. So yeah, from here,
I have to sit?
yeah, you can sit, no problem. Can I grab your hand?
Try.
Yeah.
I try.
No problem. Leave it here. So yeah, I'm gonna. What is your problem? Like, where you feel the pain?
Yeah.
On the hair. Okay. So I'm gonna touch your hand, and if you feel any pain, okay, then just let me know.
Okay.
And don't worry, it's not gonna be make worse, or it's not gonna be harmful for you. Okay.
Okay.
We are gonna check something.
You mean I bear the pain, or when I cannot bear the pain, I say
You don't need to bear the pain. Just if you feel the pain, then I'm gonna quit my examination thing. Okay. Okay. So I'm gonna palpate your where you are feeling pain. We call it lateral epicondyle.
Yeah.
Yeah. So I'm gonna palpate there, and I'm gonna give a little bit press.
Yeah.
And if you feel pain, just let me know. Okay. So here.
Ah.
Oh, it's a lot. Oh, okay. Okay. Okay, so you feel the pain over there. So I figured out there is a lot of pain on your lateral epicondyle. So we're gonna do another test. Maybe it will make you pain or not. That we're gonna check. Okay. So I'm gonna ask you to lift your middle finger. So this is my middle finger. I'm gonna
Only middle finger?
only middle finger. You need to do this.
Okay.
Okay. So you need to lift your middle finger up. Okay.
Okay.
I'm gonna give you pressure. Can you do that?
Oh, a little pain.
A little pain on that side, on the same area?
Yeah. I
Yes.
do it, like this.
Okay. Can you do it later again?
Let me do it slowly.
Yeah, yeah.
Oh.
Okay. Painful. Can you do it for me again?
Yeah. Oh.
Okay. So yeah, this is called Cousin test,
Yep.
and this is valid for testing the lateral epicondylitis. It's also called it tennis elbow.
Yep.
So yeah, I'm figuring out like maybe you have a developed tennis elbow on your elbow. Okay, what about if I'm gonna ask you to do some movements, like can you do this, like, yeah, like, yeah, and can you flex your fingers? A little bit painful.
Possible, but
Little bit pain. Okay, let it go. Okay. So I'm gonna do another test for you. It's called Mills test,
Yeah.
which is also realistic for testing the tennis elbow. Okay. We can do it standing position. We can do it sitting position under
It
mind.
doesn't matter. It's okay.
Yeah. Okay. So I'm gonna do
You
it here.
prefer.
Yeah. So I'm gonna palpate, like press my finger here. I'm not gonna pressure.
Okay.
I'm just feeling your lateral epicondyle, and I'm gonna do one movements. And if you feel any pain, just let me know. Okay. So at first I'm gonna fix your, and then I'm gonna extend your elbow.
Oh.
Oh, it's painful. Can I do it again? Yes. Flex your elbow. Oh, it's painful, huh? Okay. So the Mills test is also positive. So yeah, what is my findings? We did Cozen test is positive, Mills test is positive, and you have also, we call it extension of the wrist and flexion of the fingers is also a little bit painful, huh?
A little, but it's possible to do
It's
that.
possible to do, but it's a little bit painful. Okay. Okay. So yeah, for now I have a little bit hypothesis for your case. I feel like it's already 6 months. Yeah. So this is a chronic pain. We call it chronic pain. So, but it shouldn't be like this, because all the pain should to be gone after 3 months actually, because there is nothing happened here.
Yep.
So, but you have some stress or something. Maybe that's why the pain is still remaining there. So we will figure it out for the next session, because we're gonna do the treatment session for this.
Okay.
But I think we can help you, yeah, with this. But now I can say, yeah, you have some problem with your elbow. Maybe we can call it tennis elbow. And you have some fear of movement, I can say, because you are really afraid of doing that movements. And when I was palpating you, you were like screaming or something. So that means you are really afraid of touching that part, yeah. So I could say maybe something, we call it like fear of movement.
Okay.
Yeah. So my hypothesis is a tennis elbow with fear of movement, and for that reason we can do something for you. Yeah. So fear of movement, I wrote it down. For next session. We're gonna do the treatment. So after, before that, do you have any question?
No.
Okay. So if you don't have any question, then I'm gonna end my session here, and we will see next time, and we'll gonna do treatment session. Okay, is that okay for you?
Yes, it is.
Okay, see you under yes then. Yeah, bye bye.
Thank you so much.
You're welcome.